Hi, this is Dr. DePasquale, and anyone who knows me knows that I am very much into health, wellness, and fitness. So every day in my practice, I will see a couple of patients in either my ENT practice or my medical spa practice that will tell me the same story. They're getting older, they keep packing on pounds despite how good their diet is and how much they exercise. And I've been on a search for quite some time to find something to help these patients because in the past, all I'd tell them was to eat right and exercise and watch their calorie intake. But then I started to realize that that really just doesn't work for everybody, so I wasn't really giving my patients the best advice that I could. So I set out on a search to find products that I could incorporate into my practice that could help patients lose those unwanted pounds. So finally, I found something that had a reasonable calorie intake, 1,250 calories, which is not too minimal, like some diets require 500 calorie diets, and I just don't think that's healthy. We want to be able to build muscle while we lose the fat and lose the unwanted pounds. Also, there are other weight loss plans out there that have harmful side effects, harmful ingredients. So I was thrilled when I found a homeopathic weight loss remedy that helps people. The best part about this program is that it helps reverse insulin resistance, which is the main reason that women and men start to increase their weight gain around the middle part of their abdomen as they get older. What happens is that over our lifetime, we start to have some bad choices. We eat high sugary foods, and even if we've done it in the past, our bodies become resistant to our own insulin. So then what happens is that you need more insulin to decrease the amount of sugar that you consume, and insulin is a fat storage hormone. So even with just a slightly sugary meal, your body will start to produce more insulin than is needed, therefore increasing the fat storage. And then a few hours later, what happens is that you're starving again because too much insulin has been released, the blood sugar starts to plummet, you're starving, and you often crave another sugary food or something to give you the energy that you need. So that's really the process that starts, and people start putting on weight in their middle area, and it just keeps increasing over the years. One of the first signs of insulin resistance is the fact that you accumulate fat deposits around your abdomen and your waist size increases. Also, the inability to lose weight is a very early sign of insulin resistance. Now, this doesn't mean that you have diabetes. It just means that your body is becoming resistant to its own insulin. So how these drops work is just so easy. I didn't have a lot of weight to lose, I'll admit, but we have patients in our practice that have lost quite a bit of weight, on average about 10 pounds a month. So it's very effective and it's a healthy way to lose weight. I had 6 pounds to lose. I lost it in about 4 to 5 days, but that was weight that I was really having difficulty losing, even though I was running and training for a half marathon. So I was thrilled to get that weight off and be back into my training weight that I want to be at before the next half marathon. The drops are really easy. The first drop is called Slenderiiz, and what it is it just kind of combats your sugar craving so that you just don't crave the sugar that you normally did. I loved this because I hate diets because I'm always hungry. And with this, I just didn't feel hungry, and there were times I actually forgot to eat or would force myself to eat because I just wasn't that hungry. So it's really easy. You just put a little dropper full underneath your tongue about 10 minutes before you eat breakfast, lunch, and dinner, and then you're going to follow it with the next drop, which is basically vitamin B12 to accelerate your metabolism, and it's got a whole bunch of other herbs in there to basically decrease the cortisol production, reduce your stress hormones, and actually helps you sleep really well, which is really nice. So this drop is taken about 10 minutes after the first drop, and then you can eat right away after. The only difference is that the second drop is this one with B12. We don't usually recommend taking it at your nighttime meal just because it could possibly keep you awake at night. There are some people who have no trouble with it, but usually I recommend not to take this drop before your nighttime meal for that reason. Otherwise, pretty easy to use, and you can take them with you, and obviously you got to use a balanced diet. If you don't follow the diet plan and eat a lot of carbs and things that you shouldn't be eating, you obviously won't lose the weight that you should. This is just a great program. This is the only one that I felt comfortable having in my office and recommending to my patients because it goes along with my wellness, health, and fitness protocols that I would utilize in my own life. So if you have any questions, feel free to call our office at 904-461-6060 and ask for Chloe. She'd be happy to help you. This is Dr. DePasquale. Thanks for watching.